Postoperative Instructions, Wisdom Teeth Removal. The following will cover important information regarding proper post-surgical care for a dental extraction. If you have had a tooth extracted, it will be important to follow these instructions exactly as we present them. Discomfort is normal after the extraction of teeth. If you are not allergic or intolerant to non-steroidal anti-inflammatory drugs, start taking ibuprofen, also known as Advil or Motrin, as instructed by your doctor at the time of your surgery. If you are asthmatic, do not take ibuprofen unless you have tolerated it in the past. Gauze pads should be placed directly over the extraction sites and held in place with firm biting pressure. The pressure from biting is what helps to stop the bleeding. Replace the gauze pads about every 25 minutes. When the gauze pads have little or no blood on them, they are no longer necessary. The amount of bleeding will vary from person to person. Most of your bleeding will slow within 3 to 4 hours, but a small amount of bleeding is common for up to 24 hours. Please do not spit after surgery, as it can prolong bleeding. Do not rinse on the day of surgery. It may prolong your bleeding. Begin saltwater rinses the day after surgery and continue for 1 week. Rinse with warm salt water 3 to 4 times each day. To make the saltwater solution, dissolve a half teaspoon of salt in a small glass of warm tap water. Swelling is normal after surgery and may be the cause of post-extraction discomfort. Swelling typically peaks by the 3rd or 4th day and then starts to resolve. It can be reduced by the use of an ice pack. Apply the ice pack to the side of your face for 10 minutes. Transfer it to the opposite side for another 10 minutes. Continue icing the face for the first 24 hours. Do not freeze the skin. Ice packs are most useful for the first 24 hours. Also, keep your head elevated on 2 pillows for 3 to 4 days. These measures will not eliminate swelling, but they will help to reduce its severity. To allow blood clots to form undisturbed, do not eat for 1 hour after surgery. Gradually ramp up your diet as tolerated. Always cool down any hot foods or liquids during the first 24 hours. You should eat soft foods for the first week. For example, soups, eggs, mashed potatoes, and meatloaf are fine. To help prevent dry socket, do not use a straw for the first 3 days after surgery. Begin brushing your teeth the day after surgery. It is important to brush all of your teeth, even if the teeth and gums are sensitive. Bacterial plaque and food accumulation near the extraction site will delay healing. Do not smoke for at least a week. Smoking may increase your bleeding, impair healing, and cause a dry socket. Unless told to do otherwise, do no vigorous physical activity for 5 days following your surgery. Physical activity increases your blood pressure, which will cause an increase in your swelling, pain, and bleeding. You may gradually increase your activity, such as jogging or tennis, 5 to 7 days after your surgery.